Today we'll be looking at emergency contraception. It's really important for us to know the options that are out there, the benefits as well as some of the side effects to the contraception. There's absolutely nothing wrong with using them if you need to, and we need to have all the information that we need so when we go out there to buy, we know which ones to look out for. And throughout our conversation, we want to hear from you, so please use the hashtag breakfastdaily and the WhatsApp line 0550-585832. And if you want to buy something online as you're listening to us or even move money from one place to the other, then Absa digital channels are what you want to use. They make it so easy for you. Wherever you are, whatever you're doing, all you need is a click on your phone and you'll be able to move money from one place to the other or shop for your favorite shoe or your dress. That's Africanacity, that's Absa. And for more information on the Absa digital channels, you can just go to Absa's website, www.absa.com.gh, to find out all that's available for you. I have with me Dr. Kelvin Owusu, who's the Medical Director of Optima Diagnostics. Good morning, Doc.
Good morning, Gifa.
How are you?
I'm very well.
I've not talked to you in a minute.
Yes, you've been running from me. I don't know why.
Now, today's topic, where do we even start from when we say emergency contraception?
Well, as the name suggests, it's a contraceptive method that is used during emergency. Now, one may ask, what is an emergency?
Thank you.
In this regard? I mean, emergency, do you have emergency sex or it gets a bit complicated, but generally the original intention was that there are certain times that or certain situations that you may find yourself in that you may have a sexual intercourse that was not planned for or you're not ready for. And so in those circumstances, there should be some way to prevent pregnancy from becoming established.
Okay.
So
that's unprotected sexual
yes, unprotected
intercourse
sex,
that
definitely.
you didn't plan
so
for.
typically a woman who is on a regular family planning method, or even before I get there, now emergency contraceptive is different. It's very different from the regular contraceptive that you are supposed to take routinely on a daily basis, or the ones you get as an injection and all that. So there are two very different things. So let me just start by saying that an emergency contraceptive should never replace the routine or the normal contraceptive methods. I'm saying this because too many people use emergency contraceptives too often. So
what's the maximum you can use that in a month?
Now.
What's the maximum? Because let's say you are not on a birth control pill.
In a month?
And maybe once in a while you want to use it. Is there a maximum you are allowed?
You're supposed to use an emergency contraceptive like once a year.
Oh, really?
Exactly. That's how much
that's
you
how the emergency
allowed.
is.
Exactly. Because you can't have emergencies all the time. Then there's a problem somewhere. I mean, an emergency, an accident happens once. If an accident is happening too often, there's something wrong in the system somewhere. So you cannot use an emergency contraceptive more than once a year. You are allowed to use it only once a year.
Okay.
That's the only acceptable emergency you can have.
What happens if you use it more than once a year?
Then you should actually be using a regular contraceptive, because obviously there's something going on that makes you prone to accidents.
So it's not an emergency.
If a regular person was always, if your child was always falling down, you'd be worried. You take that child to the hospital and have a head scan to find out, is there a reason why my child keeps falling down? So if you keep using emergency contraceptive, there's a problem that needs to be addressed holistically, because the purpose of the emergency contraceptive is to address emergency situations. So I'll come back to my description. So a woman who is, let's say, on the daily pill, contraceptive pill, takes it every morning, and then forgot to take it this morning, and then the partner was overly romantic, and the one thing led to another, so they had sex. Now the woman suddenly remembers, oh, I didn't take my pill this morning. So obviously at that point she needs an emergency contraceptive. But if this woman keeps forgetting to take her morning pill and so has to resort to the emergency contraceptive, then it means that the pill is not working for her, because the pill requires you to remember to take it every morning. So if you keep forgetting to take it, then you need a more permanent family planning method, so that you don't depend on memory anymore. Okay. You see. Second, somebody if unfortunately a young lady gets raped, because you don't want the situation where there will be pregnancy as a result of the rape, that person obviously needs an emergency contraceptive. If something, so any of these scenarios or related scenarios happen, then the emergency contraceptive is your resort, is the tool you're going to use to prevent pregnancy from being established. Now I keep using the word pregnancy from being established pregnancy, because there's always this moral debate as to whether emergency contraceptive is the same as an abortion. Now medically, it's not. The two are very different. because an abortion occurs when you terminate a pregnancy that has been established. And pregnancy is established when the egg or the sperm meets the egg, and the fertilized egg now implants. It implants into the uterine or the womb. That's when a pregnancy has been established.
Okay.
So emergency contraceptives work by, one, trying to prevent the egg from being released in the first place.
Okay.
So that's the most important thing. So it blocks the fusion of the sperm and the egg. So there is no baby to be aborted.
Okay. At what point does this happen? Like after you do the do, at what point does that happen?
So this question depends on at which point the emergency contraceptive pill is taking.
Okay.
So you have a window of up to between 3 days and 5 days, depending on which specific type of emergency contraceptive you are going to use. So 3 days to 5 days. Now, the caveat is that the earlier you take the pill after the accident, in quotes, the more effective it is. So if you had sex and within an hour you remember to actually take the pill, it is most effective at that point.
Wow.
But if the longer you delay, then the higher the chance that it's going to fail.
That's
but having said this, whether you whether you take it appropriately or not, there's a chance that 1 in 100 women who take the emergency pill the right way will still have their pregnancy progress.
Okay.
You see, so I was saying that the first aim of the emergency contraceptive is to prevent the fusion of the sperm and the egg, so there is no fetus at all in the first place. If you take the pill late, which means that the fusion has already occurred, then it makes the lining of the womb hostile.
Wow.
So that the fetus cannot implant, which means there is not going to be, pregnancy will not be established.
Yeah.
So if you take it much later, when the pregnancy has already been established, when the fetus has implanted, emergency pill will not work.
Could it harm the fetus as well?
It won't harm the fetus.
Okay.
You know, so the emergency pill works like it's kind of like, you know, when you watch movies, medical drama, and then somebody passes out, then they bring these pads and they put on the chest and they say clear, and then they send an electric volt through into the heart. That is how the emergency pill works. Okay. It shocks the system. It shocks the reproductive system, so that the system, it sort of confuses the system. You know, it gives a burst of hormones, high dose hormones, to sort of disrupt the reproductive system, so that at that particular point, pregnancy being established is not likely. Okay. You know, so that's how the emergency pill works, which is the reason why you cannot be taking the pill like the way you take paracetamol. It doesn't work like that, you see. So you are allowed to take the pill once a year.
Okay.
You know, and that's very, very important, because I have personally interacted with women who have taken, like you were asking, they take the pill like once every month.
Yeah, I have a friend who does that.
That is unacceptable. That's
unacceptable. She shouldn't do that.
It's wrong. It's totally wrong, and you could have complications as a result of that. Because, like I said, imagine going to put your hand in the electric socket and getting a shock and going there to do it every day. At some point, there's going to be a burn on your hand, you know, on your finger.
So there are side effects to that?
Of course, there are side effects. Most of the side effects are mild and transient. So, for instance, you may get nausea. Okay. You know, you might get headache. You might feel a bit weak.
But you shouldn't put your body through that.
It's not the best thing to do. Okay. It's not the best thing to do at all.
So is this a conversation you have with your partner? Because I feel like sometimes the men play a role in it. It takes two to get to a point where it takes two to create the emergency.
Yes.
So if the person doesn't understand that this is something that you can only use once you have an emergency,
True.
They may be reckless in the things that they do and think that, oh, she'll just take an emergency pill and we'll be fine.
You see, issues of pregnancy, sex, and all of the and contraceptive always have it's obviously a dual role. But you see, in this regard, it's the woman who is the one who, in quotes, suffers the consequences. Yes, suffers the most severe of the consequences. You know, so you, the woman, need to take responsibility. If you are not ready to have it, first of all, even though there are contraceptive methods available for men, I mean, there's vasectomy, and they are also developing the male pill and all of that thing. And there's condom as well, but most of the men usually would not use it.
Exactly. So that's my question for you, Doc. If you find yourself in a relationship where your partner is not using condoms, so I'm asking this because I know a lot of women have experienced it. Your partner does not want to practice safe sex. He forgets to do the thing that he's supposed to do so that it does not eject inside the thing. How often can that happen? Because then it's their responsibility that's causing you to have this emergency?
You see, in this case, as a doctor, I'll attend to my patient. If the woman is my patient, I'm going to tell that woman to take responsibility.
How do you do that?
By first of all, if you're not ready for pregnancy, get on a family planning method, because thankfully there are family planning methods. At least for the women on the women's side, there are several options available. There are those that are in your control, where you take a pill every morning, and there are those that are not in your control. You just you put an implant there for 5 years. You're okay. You're not going to have a pregnancy. If you don't want to do that, then it means that you should not be having unprotected sex. But if for some reason there's an accident and you do have unprotected sex, you are allowed to take the emergency pill at least once in a year. You know.
What if you're using withdrawal as a form of safe sex?
It doesn't work.
It doesn't work.
The chances of failure are so high, and the reason why is that, number one, a woman's cycle is not fixed. The same woman can have a 28-day cycle today, and the next time is a 30-day cycle. Most women don't know how to calculate their cycle. And if you don't know how to calculate your cycle, you don't even know where your safe period is and where your unsafe period is. You understand? Now, the part that the killer is that even though you might think you've withdrawn in time, some sperms are very, very naughty. You know, because all through the sex act, there are secretions coming out and going. Secretions all over the place. There could be sperm in the secretions even before there's been ejaculation.
Wow.
So by the time you think you are about to ejaculate and you are coming out, there may be sperm already in the area. And secondly, how do you know that the first spurt, because ejaculation comes in bursts, you might miss the first burst might actually come out before you withdraw. So the chance of failure is so significantly high that no medical person will advise you to practice the withdrawal or even the calendar method, because the failure rate is so high.
Okay.
You know, and so don't do it. In this, like I'm saying, there are so many safe alternatives out there that it doesn't make sense to be practicing that at least in my opinion. It's
outdated.
It's outdated.
We need to
we need to grow with the times.
Doc, what are the options available for those who may have to do that emergency?
So there are two major blocks of options available. The pharmacological, which is the pill, the emergency pill that you take, and then there's also the mechanical, which also tends to have some hormones in there. That's the IUD. Okay. So we all know the IUD, the intrauterine device, as a regular family planning method, but the IUD can also be used as an emergency contraceptive. So if you had accidental sex that you're not ready to have and you're not sure whether you're in a safe or unsafe period, you can actually go for an IUD insertion within the 72-hour window.
Nice.
And again, the earlier the IUD is put in, the better. So once you put the IUD in, it will prevent the implantation from happening, and then the pregnancy will likely not happen. The advantage of the IUD is that when you put it in as an emergency, you don't have to take it out. So you can actually leave it in there for the duration. And some IUDs can go up to 10 years. So if you're not ready to have a pregnancy for the next 10 years, it may have been an emergency situation that made you put it in, but you don't have to take it out. So you can actually remain there, so that then whether you forget or you don't forget, you are safe.
They have 5-year ones.
They have 5-year ones. They have 2-year ones. It's up to you and what your plans are. You know, so you can go up to 10. But by 10 years, it has to be taken out. That's a bit too much. You know. But one thing I have to stress on is that emergency contraception does not protect you against STIs.
Yeah, obviously.
It does not prevent you from catching the HIV, the hepatitis, the syphilis, gonorrhea, and all the ones that we are here to discover.
Because that one's just straight into your body.
So even though you are on contraception, you need to use a barrier method if you don't trust your partner. And when I say barrier method, I'm talking about a condom, whether male or female condoms, to prevent exchange of fluids. That's the only way you can prevent an STI prevent yourself from catching an STI.
And this is just not for penetrative sex, but all forms of sex as well.
Well, in today's world, you can't be too careful. So you have to actually use protection for all forms of sex, especially sex that bypasses the. I need to choose my words carefully. The natural area.
What do you mean by natural area? That's relative, no?
Relative how?
So people might see other areas as natural.
When it comes to sex, the other areas are not. That's why I put it in quotes. There's an area that is purposely designed for penile-vagina or for penetrative sex, which is the penis and the vagina. Okay. I mean, it's morning TV, so it's a bit difficult.
So those two are the areas we.
Exactly, and so any sex that involves any other areas, any other openings, there's a higher risk of catching some of the STIs.
Okay.
So, case in point, if you have penile-anal sex, the tissue, the cells in the anus are not meant for that scientifically. And so the adaptations in the vagina that can accommodate some of the actions are not present in the anus. And so you are more likely to have injury to the anal and rectal cells. And once there's injury, it's much easier for the germs that cause the STIs to spread into the bloodstream.
So you might want to use protection
for
those
important.
Types of
very
sex
important.
that may not be scientifically normal.
Exactly. So it's very important that people understand some of these things and take the due advantage. And for people who are who practice what's it called, cunnilingus and fellatio and all those things, now you are taking things from areas that are not normal to other places. So for instance, you engage in oral sex, and then following that you go on to do a penile-vaginal or penile-anal sex. You carry germs from the mouth into the vagina or into the anus, and sometimes, and this is a bit, but sometimes they actually do the reverse, where they carry germs from the anus or the vagina into the mouth. So you now have germs that are normal, we call them normal flora in the vagina appearing in the mouth, and that's a problem. So you're going to have issues in the mouth, which are not supposed to be there, because again, the areas that you are supposed to have had a normal sexual relation, it didn't happen like that.
So we'll have another conversation about that, what to do in those cases, because there are people practicing it in their marriages and in their relationships.
They are spicing up their marriages,
and you have to do it in a way that you protect your health as well.
Very true.
So are there any specific ones you will recommend as far as the emergency contraceptives and some of the side effects that we should keep in mind?
So thankfully there are quite a number of brands out there now. I mean, there's the
popular one that's in the movie
Posting or two that almost everybody knows about. But thankfully there are so many. I mean, Lydia has one. So many other.
Are there any extreme side effects to any of these?
The extreme one extreme side effect is vomiting. Sometimes you take, because you are shocking the system, and so the body sometimes will reject it by vomiting. Now, and thanks for bringing that up. I almost forgot. When you actually vomit,
I knew you would.
When you actually vomit after taking the emergency contraceptive, within an hour, you have to take it again.
Why?
Because the possibility that you have expelled it is high. But you see, here is the catch. Because you are vomiting, it might not be wise to sit at home and take the second dose by yourself. So it's better that you report to the hospital and let them be aware that I took the emergency pill, I vomited, so I've come. So that then you are monitored for that second dose you are going to take. So that should it happen again, then at least the doctors or whoever is aware that, okay, she's vomited again, now we have to do something else. Because if you don't do that something else, then that pregnancy you're trying to prevent would establish itself, and that will come with all the socio-economic implications associated with pregnancy. So it's important that we know these things and then act accordingly. Because if that pregnancy becomes established, wahala day.
For the rest of your life.
I'm telling you.
The longest commitment you'll make in your whole life. Dr. Kelvin, where do you follow you on social media?
Well, I'm active on most social media platforms like Kelvin Owusu MD. So I mean, you can ask any question and I'll address it.
Thank you. I'm looking forward to you launching your YouTube channel soon, so that we go there and you answer questions for us. Thank you so much, Dr. Kelvin, for being
awesome.
with us. And there you have it on emergency contraception. Okay, the most important thing is really abstinence, if you can, or practice safe sex, so that you don't have to put yourself in a situation where you're taking emergency contraception more than once a year. You don't want to do that to your body. You have to be kind enough to your body, and you have to have these conversations with your partners so that they understand that they cannot be irresponsible when you are engaging in the act, because ultimately the woman will pay the price for swallowing these pills or inserting these things in their bodies, and we have to be kind to our bodies. Hi there, we hope you enjoyed the show.
Make sure to subscribe, like, comment, and share with your friends.
This is Breakfast Daily on City TV.
Join the Breakfast Daily team Monday through Fridays from 7:30 a.m. to 10. Join us for breakfast daily, only on City TV.